Welcome to Lift Your Future, a podcast that teaches you coping skills through stories, methods, and proven techniques to improve relationships and outcomes in your personal and professional life. I'm Nicole Winkler, a licensed therapist and executive coach. On this podcast, we'll share relatable life experiences designed to help you grow. I will provide easy, practical ways to develop thoughts, feelings, and behaviors to impact your life, both personally and professionally. My goal is simple: to help you lift your future.
Thank you so much for tuning in today. Today we're going to talk about burnout, compassion fatigue, and mental health implications from the pandemic that we're all still very much living in today. Our guest is Robyn Burnett. She is the account manager She is the supervisor of accounts and education at Methodist Best Care EAP. Really looking forward to having her on the show. Hi, Robyn.
Hi.
I'm so excited that you're here.
I'm excited to be here.
Yes. So you work in business and you work in mental health. There's a lot of synergies there.
Yeah.
And that's really how we started bonding when we work together.
We have similar brains.
We really do.
We're not typical clinicians, I think. Mm-hmm. You know, if we were to go take an assessment, typical clinicians, I think, are on one end of the spectrum, and I think there's Nicole and I. We definitely have a business brain.
Absolutely. And I love your business brain. I love picking it. I love all the reports that you do and the presentations you do for companies. And I also know that you had your third baby recently.
Yeah.
So how old is he now?
He will be 3 months next week. So he's joining a big brother who just turned 5 and a big sister who's 3. So busy.
So you lost all your marbles?
Yeah. No. Yeah. I think that might have went out the window with the first, but each time it gets worse and worse. Absolutely.
So is it true once you have your third, it's a whole game changer?
Yeah, I would agree to that. People warned me about that, and I apparently didn't take it seriously, so here we are. But yeah, it is a game changer. I always have said now since having him, it's not for the faint of heart or for the weak, mm-hmm. because it's a whole nother ball game. Mm-hmm. Just trying to navigate everything, you know, it's adding to the already chaotic life I had before.
Well, I'm working full-time, being a full-time mom, and additionally your husband is surgery fellow.
Yes.
Transplant fellow. Mm-hmm. So that means he's hardly ever around. I mean, and not for not wanting to be, but that's the job, right?
Right.
He's on all the time. So you have that, and then you have a pandemic.
Right.
That happens once a century. And how have you been managing all of this?
You know, I don't know. I'm taking it day by day, but it's funny you're talking about all this, and I was thinking about when I had Cass, my third. I was in the hospital, and one of the delivery nurses was talking to me about all the things, I was just telling her about my life, and then she met my husband, and she said, "You have a rock star wife," in case you didn't know that. And he said, "Oh no, I know." But she the whole time thought I had a nanny. She just assumed.
Oh. Because of all the things that you do? Yeah.
I said, "Oh, no. She said, "Oh my gosh, you do this alone?" I said, "Well, yeah. I didn't know that was that big of a deal." But, when I say it out loud, mm-hmm. sometimes I am even surprising myself with mm-hmm. all that I do.
So do you think you just have an enormous amount of energy to get through all of it? Or do you organize yourself really well?
No, I'm not organized at all.
Okay.
I'm not. And I used to always say that I was, but I'm not. Mm-hmm. I'm pretty... go with the flow, just whatever happens. I like to always be doing things, mm-hmm. so probably more so the energy piece, mm-hmm. But no, not organized at all. The only thing I have tried to get better about is putting things out the night before. Mm-hmm. Trying to plan my day out a little bit so my morning isn't so chaotic, because mm-hmm. You're a mom, mornings and evenings are crazy busy.
Oh yeah.
And so I just try to at least plan out my morning mm-hmm. a little bit. So for example, this morning I had the kids' bags laid out. I had, of course I'm nursing, so I had all my pumping stuff ready to go.
5 million bags.
Yeah, I'm the bag lady. I had everything organized for my lunch and my snacks, because I was in the office today. Normally I've doing a little bit of hybrid at home and in the office. So,
Oh, that's so nice.
yeah, I think I am organized to a degree, but not near like I probably should, or what would make my life a little bit easier.
Say your flexibility, like your ability to be flexible with, okay, kind of go with the flow, whatever happens,
I'm very flexible.
probably prevents you from being like losing your mind.
Yeah.
Because I remember early on in parenthood, I was like, okay, it's going to go this way, this way, this way, and this way. And it didn't go any of those ways.
No.
And then it just increased my stress and my anxiety so much more. And so when I learned to be a little more calm, like, guess what? They're going to get sick. Of course they're sick again.
Right.
The pediatrician should be at my dinner table for Christmas because we see our pediatrician so much.
Yeah.
And things like that. It was really a lot easier for me. So organization with some flexibility, I think that's a great combination.
I'm incredibly flexible, almost to a fault, where I can't ever stand firm on something or even make a concrete plan. And it's not necessarily that I'm waiting for something else to come up or something better or more fun. It's just, I can't really commit. So, and most people who know me well know that's just how I operate. I'm incredibly flexible to the extreme.
To a fault sometimes.
Yeah.
But if it comes down to it, and hey, I have plans tonight, or I can get 3 more hours of sleep, that's a no-brainer. You have to get the sleep.
Yeah, one thing I've found about myself now since having Cass is that I'm much more okay with saying no to people, and I'm also enjoying just being home by myself. And part of that is, you had asked about in the midst of a pandemic. That's something new to me, of being alone. I like being around people all the time. And I'm very, very social to the extreme. But with the onset of the pandemic, I've gotten so much better about being a homebody and enjoying the things about being at home, even if it's with 3 crying kids. But I've adjusted to that, and it's fine. So getting better with it.
So what have you seen? Have you seen any trends this year in 2021, especially because the pandemic started March of 2020? What trends have you seen with clients this year?
I think universally, it's this high level of burnout.
Yes.
And employers don't know what to do about it. They know it, they see it, it's happening before their eyes, and they don't know what to do. And often, even, on the folks that are working managers, they're working managers. So they have their own workload to do. So they're not able to even check in properly with their staff, engage how they're doing, and figure out solutions to better the situation. So it's just a really big mix of issues right now. And I think burnout, and specifically in helping professions, this whole theme of compassion fatigue. Something that was a little unique, at least for me, was experiencing people having symptoms of compassion fatigue that weren't even in a helping profession historically. So people in human resources, people who were even in call centers, people who dealt with insurance claims, and hearing really horrific stories from people. They were suffering and continue to suffer symptoms of compassion fatigue, which is slightly different than burnout. It's just a different subset. So those are the big things that we keep hearing, are burnout and compassion fatigue, and how do we support those folks so they stay because of where we're at with employment.
Yes, and saying, I know you're burned out.
Right.
We care about you. We will do anything we can, but you still have to come to work.
Yeah.
I can't give you any days off.
Right.
You still have to come to work because we don't have enough bodies here.
Right.
Or we don't have the support here for our staff. So can you please come in a half a day instead of maybe a whole day?
Employers are thinking outside the box for sure. What can we do if we can't necessarily match what other people are paying, because we're seeing really, really high numbers coming out for compensation, which seems really nice. But for those employers that aren't able to match that, they are trying to think outside the box. What can we do better to enhance their benefits? Maybe it's offering much lower deductibles. Maybe it's or premiums. So employers kicking in a little bit more there, or better retirement, or better people like an EAP, a more robust EAP, and offering more counseling sessions. or
more resources.
Or maybe actually looking at PTO. You know, what can we do to better align ourselves with other employers, or a hybrid work environment? You know, can we be flexible? What is it about their job that necessitates them being in the office, you know, 5 days a week?
Yes.
So
now we know we can do that.
Yes.
So why aren't we doing that if it's a possibility?
Right.
Sure. Well, we can still measure productivity.
Yep.
In
Making
those ways
sure that
as well.
things are getting done, and you know, bringing in a masseuse. You know, things like that I think, you know, employers are just having to think outside the box with that. I had seen in the paper a couple weeks ago, I actually haven't talked to this employer, although we have a partnership with them, but Strack. I don't know if you saw, but they're actually putting up an apartment complex. This is really the first of its kind in the Omaha area, but they are seeing a need where people have a hard time finding affordable housing, and also transportation issues getting to and from work. So they're putting up a really nice apartment complex right next to Strack that's going to be reduced to even maybe free housing for those folks that work for Strack.
Wow.
Yeah, so it's
something,
see that. It's something really unique, and I think it's pretty cool to look at something like that, where what are employees' challenges outside of work?
Right.
Is it that they can't pay their bills? Is it that they don't have proper childcare? Is it that they can't get to a bus stop, or they can't afford gas?
Well, it's very much like Maslow's hierarchy of needs.
Right.
Like, do you have food on the table?
Right.
Are you able to afford your groceries? Do you have a house that you are not behind on rent and you're not stressed about that? How are you supposed to be productive when you go to work?
Yeah.
If those things are not met.
Yeah,
if you're not getting
out.
good night's sleep, if you're not, you know, if your brain's not functioning at its full capacity.
Right.
Yes, absolutely. That's a really, I'm going to keep looking on that. That's a really cool idea.
It's really neat. Like I said, I haven't talked to them personally about this. I just read it in the paper a couple weeks ago, and I don't even know. I think it must have been in the break room because I don't even read the paper.
I was wondering when you said reading the paper, I was like,
that's not a regular habit for the record.
Well, maybe you picked it up during the pandemic. I don't know.
No.
But you know, there's also with this the Great Resignation, and people asking for what they want from employers now more than we ever really have seen, I think. Yeah. And so that is another, you know, hey, you could do this or you can leave, and there's other opportunities for you. But the unemployment rate is extremely low right now.
Yeah, you know, I think it goes twofold, and this is on a much bigger scale, and I'm not economic savvy, but at some point it has to bend, you know, because even though employers, you know, employees are asking for higher compensation, they're asking for things that are stretching employers pretty thin. But then there's also these big corporations that it's about time that they give a little more flex to employees, whether it's higher compensation. I know locally I've talked to several people, without naming any names, but in healthcare, that are jumping ship for upwards of $100,000 more than what they're making. Wow! So that's huge.
That's a lot. That's significant.
That's something that I think employers really need to look at. You know, I think it seems too far out of reach, but what is the cost? You know, and the cause and effect. If we're not going to bend more, we're going to lose clients.
Right.
Or consumers or patients or whatever the case may be.
Well, and having two employees at $40,000 a year, let's say, that come to work, don't necessarily enjoy their job, they're barely able to afford living expenses outside of their job or gas to get to their job, they likely have other things, they might have other things in common. And then you hire one person at $80,000 a year that is not worried about those things, or $100,000 a year. You know, you really, instead of having two bodies, you have one body, but you get potentially a lot more productivity there. Yeah. And so looking at in terms of what does that, or even if somebody who loves their job and loves coming in and they're making that 80 and it's one person, you get a person and a half sometimes with that. Yeah. And not somebody who's taking a hour-long lunch and then 7 bathroom trips and, you know, just kind of trying to get through the day.
Yeah. Yeah, there's other resources too. You know, a couple years ago, two women here in Omaha developed a company, and it's basically a model. It really catered towards working moms, but it was basically job sharing. You know, if you and I are both really, really good at this, why does an employer need to hire us at full time with full time benefits? They get 2 for the price of 1, but yet I have the flexibility of being a working mom and not have to work full time. So there's different ways that employers can look at hiring. It doesn't have to be your traditional 40 hours a week, full benefits, whatever the case may be, that you can look at different options, and there's a lot of great resources. But we have too many, especially in Nebraska, being in the Midwest, we have too many traditional models that
very traditional.
It's hard for people to see outside of that. But I think this is forcing them into that, unfortunately.
Well, the pandemic, the burnout rate, compassion fatigue,
absolutely.
People resigning. It's kind of the perfect storm.
Really, I know. And people predicted that early on in the pandemic with the emotional toll that people were going to experience, and some even said it would be a much bigger toll than what physically the pandemic did. And I'm not going to argue that, but we're seeing that now, and I think we will see it for years to come, for sure.
I do too. I don't think we even know yet.
No,
we don't even know.
And I think also it's on a much bigger scale too, when we talk about people now leaving a traditional work setting to go work from home. What is that going to do to our socialization as a whole, as a society? And then we also talk about, when kids were going, doing their studies at home as well. Again, understandably so, we did that.
Of course,
but,
of course.
There are repercussions. We're seeing that now, a year and a half later, of kids that had to go be in home versus socializing.
Yes, well, the socialization aspect, the academic standard aspect, I wonder what we're going to see with that, if that's going to change and become lower. I have a friend who's a teacher, an elementary school teacher, and she said, I have to remind myself constantly that my students haven't had the education, the traditional or normal way that they normally would have. So when I'm seeing these social issues come up, and they are acting like they are in 2nd grade, I have to remember that was their last normal year of school. Was 2nd grade. They have not had the socialization that they would have normally had in 3rd grade and 4th grade to be, to show up as I would normally expect my 5th graders to show up. And
it's interesting too, you have some parents that talk about their kids that experience school before and after the pandemic, and then my kids will start school long after the pandemic started. So my son Cedar will start kindergarten in August. So what I thought would be the normal setting for him won't be. That I don't know if it'll ever be the same. I mean, I hope at some point it is, but that that will be his normal.
Yes, normal is not. I mean, normal's always been relative, but I think more than anything, we've been shaken up and spun around and set back down, and there's a lot of things that are not in equilibrium like we always thought or expected them to be. So probably an important lesson for all of us in terms of what are our expectations. Because when we do attach expectations to things, we can be disappointed, we can be judgmental, we can, and so trying to take the judgment out of that and try to keep our emotions, especially the more what we would consider negative emotions, in line, and mellow. Like, okay, well, this is how it used to be. It is no longer that way.
So your girls, for example, they definitely knew a time before the pandemic what school looked like, and then during and now after. So
and they seem to be very well adjusted, of course, but I don't know.
Well, they have used them up.
Oh yeah, it's all because of me. It's totally because of me. Did we just cross our leg, cross and recross at the exact same time? Oh boy. But yeah, I mean, I hope so. I hope I provided them this stable, I hope so, but I also...
And not everybody has that, unfortunately.
No, not everybody has that ability to do that as well. So, and I empathize with that, and I understand that. So I think teachers are doing the best that they can do, and they're burned out too.
They're very burned out, and I think this is, I talk a lot about healthcare because it's a little bit of our niche is working in healthcare, but what I think we're going to see, there's going to be a huge bubble when it comes to our educational system, because we have a lot of employers at, we'll even say at the state level. So look at our state prisons. They just recently increased the pay substantially because they can't keep people. And that was something that needed to happen a long time ago.
Very long time ago.
But what they haven't raised the threshold on is our teachers.
Yes.
There's not been a substantial pay increase for our teachers. And this is nationally. This is not necessarily anything in Nebraska, but we're going to have a lot of teachers walking out, and that's a guarantee. My sister-in-law came from the corporate world, making over $100,000 a year, and got completely burned out of that world. Wanted to do something different, give back, get her teaching certificate, and teach business to high schoolers. Well, this isn't what she signed up for either. Just like our nurses didn't sign up for this, our doctors, many people didn't sign up for this. But you've seen every other standard of labor increase based on what we're experiencing, except our teachers.
Yes.
So they're expected to continue to put up with all of this BS.
Really to mold our next generation, because our kids spend more time with teachers
and
than they do with us sometimes. Like my girls, some days they go to school for 7.5 hours.
Yeah.
Then they go to dance for 3 or 4 hours after. I get an hour in the morning with them and an hour at night with them.
Yeah.
And so a lot of their learning comes from other people too.
Yeah. And our youth in general are struggling. So our teachers and the students are seeing so many more fights in school. We have students that are straight up abusing our teachers by verbal, and it gets physical, and they know there's not really any repercussions to them. They can't even really suspend. It's just,
well, then they'll fall further behind academically.
Absolutely.
So we need to have them here.
Right.
We need to have them in a separate room. Well, then there's isolation.
Yeah.
But then we also, like the peers, especially around the age of 12-ish, maybe even earlier now, puberty time. Peers become the world. Like peers become kids' world. It's what their peers think about them and how they are perceived by them. Authority and teachers and parents, unfortunately, kind of get the back burner.
Yeah.
That's a normal development. Erickson's stages of development, psychosocial. That's very normal. But we also want to be aware of that, and how can we help support our teachers and give them those directives to, hey, you don't have to be abused. You don't have to. But then I think the teaching profession is also so specialized that now you have to go back to school.
Yeah. Well, but there are a lot of, unfortunately, there's a lot of opportunities right now for people to go work from home if they want to, or, get out of teaching completely. And that's the unfortunate part, because we don't want people doing that. We don't want people to consider doing that. And I know my sister-in-law and a lot of her friends are considering it because they don't see those changes happening anytime soon. But I do think they will. They have to, because we have so many teachers that are leaving. In Oregon, for example, they are actually hiring 18-year-olds who don't have a teaching certificate to come in and substitute.
Wow.
That's where they're at in Oregon. So I think that something needs to change. Otherwise, it's not going to be good. We're not going to have enough teachers to teach our kids, and who are our most valuable.
I don't know about you.
Human beings.
I'm not designed to be a teacher.
I say
elementary
that all the
age
time.
Students, homeschooling.
I wouldn't be
my
equipped
children and working and doing a doctoral program. That was enough for me. That was enough of a sample size for me.
I walk into my kids' daycare all the time and say, I don't know how you do it. Yeah, thank you for what you do, because I don't know how you do it.
Well, your kids are at a academic daycare.
Yes.
And so it is and my kids went to one very similar to that. So by the time they went to actual school, even though they had COVID that impacted them, I think that there's a lot of research about early education, 5 and under education, and shaping the brain and getting it ready for learning and structure and development.
Yeah.
And that's exactly why we chose that too. So I don't think our kids have been as impacted by the pandemic because they had that. I wonder, I don't know what the research says, but for those students that did have that experience in their early learning years and developmental years, if that will have any impact on how school has been, the pandemic has affected their educational
Yeah, that would be
experience.
interesting to see for sure.
Yeah.
But yeah, teaching would not be
Not your forte?
No.
No.
You won't see me jump in ship to go be a teacher.
What would you jump ship to go do? What would be like if you didn't have to go back to school and you didn't have to learn a whole nother industry, what would you do?
I really, the part of my job that I enjoy the most is being community facing and being a community advocate for mental health. So I think that if I were to ever jump ship, it would be more to be a community liaison for an organization, speaking the mission of an organization, and just having that community reach, depending on what it is that I was speaking about. And if I knew that well enough and could speak that, I think it would be, I enjoy that.
Yeah, to impact as many people as you possibly can. I know you did a lot of that in your former role.
Yeah.
As well.
Yeah, and with the pandemic, I have been very much externally faced because of people wanting mental health resources. So, and not really knowing who to go to. So oh yeah, I think Robyn can talk about mental health. And I really hadn't done that a lot before the pandemic, and then just fine-tuned my speaking skills to be able to really articulate why mental health is important, why we should all be talking about it, and what do we do for our next steps to better our community. So that has only come about because of the pandemic. I see, for me personally, there were so many silver linings with the pandemic. I got to stay home with my kids, although they drove me up the wall, but I got
That's their job. That's
I got that opportunity because as a working mom, I would have never had that opportunity. But then also just getting that exposure of being out there talking to people, facilitating discussion, giving presentations on a pretty big scale and talking about mental health.
I appreciated that as well about the pandemic. There were many people that reached out to me knowing I was a mental health professional.
And as a clinician, we've wanted that for a long time.
Oh yeah, I'm like, hey, mental health is important.
Yeah.
You don't have to have a major mental illness to give it attention.
Right.
Like everybody has felt depression. Everybody has felt anxiety. And there are people that live with that every day. Before the pandemic, after the pandemic. And it goes, like I think I've said this in another podcast, but I think of depression, anxiety on a scale of 0 to 100. And being at like a 20 is uncomfortable, and maybe you're a little unmotivated, or maybe, it's just harder to get up in the morning, and being at like a 90 is, I want to hurt myself and I don't want to live anymore. And there's a whole continuum with both anxiety and depression that people fluctuate on as well.
Right.
And so getting that word out there and saying what you're feeling is this, and I have found that so many people are just relieved to know that there's a word for it.
Yeah.
Like, that's anxiety?
Well, and
yes, that's
like
anxiety.
You said, it doesn't mean that you have to have a major mental illness to seek help. It's our day-to-day struggles that we could all use some extra help. It's this much bigger entity of well-being. How do we keep ourselves well so we can be more productive, so we can take care of our kids, so we can be a better wife or better partner, whatever the case may be, but just bettering ourselves.
Well, I don't know about you, but a lot of clients I've worked with over the years, I've said, well, just because you can power through and do it, I have no doubt that you can.
Right.
You've been doing that.
That's a great way to put it, yeah.
I have no doubt that you can. Just because you can doesn't mean you have to.
Yeah, or that you don't have to alone.
And there's support. And let us support you. Let us give you resources, tools. Maybe a deep breathing exercise that you do is enough for a minute, 60 seconds of your day is enough to calm you down so you can make a rational decision and you're not going back and apologizing for it later, whether that be at work, whether that be with a spouse, whether that be with a family member, a child. Like, we can teach you those strategies. Like, these are
evidence-based strategies. And I would love to do that, and so it's kind of like unarming, like, oh, you're right. Like, it doesn't have to be this hard.
Yeah. Yeah, and I think also I have recently come to the conclusion that if somebody offers me something and that there's some sort of higher being that is telling that person to reach out, take them up on it. I have gotten really good I've gotten really good.
That is not who you were a couple years ago even.
No, I would always say, I'm good, thanks for checking in, I'm fine. But now it's, if somebody says, hey, I know you have a lot on your plate, can I bring you a meal? Or can I help you do something? Can I watch the kids while you go grocery shopping, or go this weekend, it was Christmas shopping? Yes, that would be wonderful, because I have no time to do any of that. And you can't expect people to just automatically know what you need or what you want. Sometimes you actually have to ask that of people.
Yeah.
And getting out of that uncomfortableness of asking for what you need, it's hard. But
yes, and I think that also brings up another idea for me. We oftentimes go through life so much on automatic pilot, like, hey, how are you? And the automatic response is,
fine, I'm good.
Yeah, how are you? Right? Oh, good. How are the kids? And we move on. But how are you really? I find myself asking people those questions.
Yeah.
How are you, really?
Yeah.
Question mark.
Genuinely asking somebody how they're doing and look them in the eye. You can do this even on a virtual setting.
Yes.
Impress them. Ask them again. No, seriously though. How are you doing?
Yes.
And 9 times out of 10, you're going to get a different response that second time. My mom always says for me it was 3 times, because growing up I was always that same way too. She would,
I'm fine.
Yeah, I'm fine. And she'd always say by the 3rd time I'd start crying.
Well, and that's the thing. It's like, oh my gosh, this person is here and really cares to know how I'm doing. So I've also practiced that a lot more this year. When somebody asks me, how are you? I might say, oh gosh, just really stressed out right now, or really busy, feeling a little overwhelmed or exhausted, or however I'm really feeling, or I am feeling great. I accomplished a lot this week. I'm feeling great about that. But I give more context to it in my answer, in hopes of when I look at somebody, it's very like a pointed kind of look. It's like, no, how are you?
Well, and just asking the question and genuinely asking goes a long way. And it doesn't mean that somebody needs to get into an in-depth response. Sometimes, I don't know about you, but I just don't even have the energy to respond to people. I'm just like, oh, my life is just
so tired,
shit show, and it's okay. And I don't want to get into it, but just you being here with me right now and you asking me means the world.
Yeah, thank you.
Let's just hang out.
Yes.
I don't want to get into
No, we don't need to dig in, right?
And I think the same goes for if you're talking about an employer level with their employee, or a peer-to-peer level at work. But just genuinely asking people how they're doing really can mean a lot. You never know what kind of impact that can make on someone, especially if they are more on that high end, that you had talked about.
Just smiling at somebody. What research tells us, smiling at somebody and saying hello increases people's moods.
Yeah.
And it does. It sets the tone for your day. It's kind of like the mind is a dark room, and wherever you shine the flashlight is what you're going to see for the most part. So shining it on, that's very positive. Like, you smiled at me. That was that was uplifting. They noticed me.
Yeah.
And I think in this world of kind of everybody's kind of exposable and expendable, and everybody's so tired and everybody's so burned out, it's really nice to get that just genuineness, like, hey, I'm holding space with you.
Yes.
We don't have to get into it.
Yep.
I don't even know if I could handle it, because I have my own stuff that I'm going through or whatever, but I'm here and I'm going to hold that space with you, and I want you to know I just care.
Yeah. I think it means a lot.
I agree. Thank you so much for being on today.
Yeah, I thoroughly appreciate it. This is awesome.
Would you come back?
Oh, of course.
Yes.
Yeah,
Okay.
we can always talk about more in-depth things, if we want to just focus on one thing.
Well, I know you have quite a library
I think of it as like a card catalog, which are like, that's how old we are. Card catalog.
I love the reference. I know Matt probably loves that reference too.
Yes. And so a whole card catalog of all the things that you've researched, that you've presented on. You are a wealth of knowledge and resources.
It's always something new too. You know, I'll read something and I'm like, gosh, that's interesting, and I want to dig a little bit deeper in it. So I'm back on this whole social media track. So if you want to, yeah.
Okay, wait. Can you give us a little teaser or a little information?
Well, just the effects that social media is having on us and our youth. There's a new nonprofit here, newer. It's called Next Gen Society. I don't know if you're familiar with it.
I have heard of it, but I'm not familiar with it.
I actually she'd be a great one for your podcast. But it's some really interesting stuff, and it's basically having groups. You can do it, you know, just in a work group, your friend group, or that she's doing it with high schoolers, to do a pledge to put down their smartphones for a week at a time, you know, take off certain apps. And the amount of control that our phones and our apps have over us and our youth is just mind-blowing.
Yes.
And what it's doing in creating anxiety and depression, it's really sad. So it's something that I would love to talk more about. I'm certainly not an expert. I just love to talk about it.
I would love to talk about it. I don't know when I did that, Matt. It was on Matt's podcast.
Oh yeah, you did
our
do
producer,
that. Yeah.
Of this podcast, and so I am very passionate about that, and I would absolutely love to talk more about that.
Yeah.
So we will get that scheduled. Robyn will be back with us soon to talk more about social media and the impact, and even technology as a whole.
Yeah.
Because we know it's designed to suck us in. I think Matt and I had talked about it in the spin on addiction, which is extremely addictive.
Absolutely.
It is designed that way. And yes, what we're seeing in especially teenage females, but it's very prevalent in males as well.
Yeah.
They just cover it, but the research is starting to show us quite a bit more with males as well. But it is damaging in those very critical years too.
Yeah.
And if you think about it, adults have a hard time.
Yeah.
Like, well, I have a hard time when an alert comes on my phone. We're like a bunch of little Pavlov little humans here. Like, my phone buzzes and I take it out to look at it, or I look at my watch, or you know, like, it's just this automatic response now that we don't even think about it.
Right.
I'd be in the middle of a conversation, like,
yeah.
Okay, and then I'm right back here with you. Well, how are you supposed to feel I'm connected to you if I do that?
Right.
So yeah, we can get into a lot of different
another time, another
of
place.
That. Yes. So thank you again for being on the show.
Thank you.
I appreciate you very, very much.
No, I appreciate you. Thank you for
and all the work that you do in our community. Thank you.
Yeah. Thank you.
Bye.
Bye.